COVID-19 cases continue to rise slowly in the U.S., and that includes here in California. On top of that, the monkeypox virus is causing some concern after making its way into the U.S. California's first suspected case reported in Sacramento last week. But the World Health Organization does now say it is unlikely the monkeypox outbreak seen in parts of the world will turn into a pandemic. Joining us now is ABC's chief medical correspondent, Dr. Jennifer Ashton, to help us make sense of all this. Hi, Dr. Jen.
Hi, how are you?
I'm good, thanks. So can you put into perspective the rise in COVID cases and what people should know and should do when it comes to just living their daily lives?
Well, I think that we're at the point right now where we probably all know someone who may have COVID right now, or certainly who has had it recently, myself included in that. I think we're at a very different stage in the pandemic, obviously, where this is our third summer, believe it or not, and the virus isn't disappearing. So as we continue to hear cases going up, and, you know, they are going to go up at different times as they'll drop at different times, we have to remember that the goal of the vaccines, and in fact our public health goal, and this was re-emphasized by the CDC in the last several months, is not just that we should be having low cases in the community, but we really want to keep our hospitals and healthcare systems safe and unburdened. And so the vaccines are largely doing their job to that end in keeping people out of the hospital, the ICU, and saving lives. There'll always be deaths from this virus, just like there are deaths from influenza, unfortunately. But it's really a matter of learning how to live with it and learning from what we've been through in the last 2 and plus almost 2.5 years now.
And we have seen some places returning to indoor masking. Also, haven't seen much of a push right now for the majority of eligible people to get a second booster shot. Where do things stand there, and what are you recommending?
Well, I think we have to pay attention to what's going on in our community. And now that messaging should be fairly well established throughout the country. And understand that masking for the time being, you know, we all should have a mask on us at all times, because we may, in fact, be going into a business or a restaurant or public transportation that requires it. Also, it's a relatively low risk, high benefit behavior for us to take as individuals to protect our own individual health. So, you know, I think that when we look at all of these factors, we have to take our own individual responsibility, and then we have to take our responsibility to protect those around us in our homes and workplaces and communities, and put those two things together and try to get on with our lives.
All right, let's talk a little bit about monkeypox. So the WHO doesn't seem to be too concerned that this is going to get out of hand. Can you explain their reasoning?
Well, I think they're tracking it, first of all, and no one has a crystal ball in public health. The World Health Organization is no different. They are expecting the number of monkeypox cases to go up. There's a saying in medicine, when you look for something, you're more likely to find it, and this is no different. But this is not an incredibly contagious or easy to transmit virus. It does require direct person-to-person contact at this point, skin-to-skin contact, or contact with infected clothing or bed linens of someone who has it. And from exposure to presentation or onset of symptoms can be about 1 to 2 weeks. So they're going through the same steps that we may remember at the beginning of COVID, identifying, isolating, contact tracing, those things. But if you're healthy with a good immune system, your chances of becoming seriously ill with this virus are low. But certainly the pictures are frightening, and no one wants to expose themselves to it. But right now we're just paying attention to it and keeping our eye on it.
All right, so definitely keep our eyes open for that. I also want to ask you about the unexplained hepatitis cases in children. Dozens of cases reported in dozens of states. Can you explain this to parents and what parents need to be aware of?
Yeah, so hepatitis is an umbrella term for liver inflammation. This is called a hepatitis of unknown origin in the pediatric population. World Health Organization also now tracking over 600 cases. They also expect that number to rise. They don't know why. They think there may be a link with another virus called adenovirus that is common to kind of produce upper respiratory or gastrointestinal symptoms. Most of these children are under the age of 5, therefore have not been eligible for a COVID vaccine. It's not related to the vaccine, and it's not the hepatitis A, B, C, D, or E varieties. So right now, they're still in the medical disease detective stage of looking at this outbreak. But parents whose children have any yellowing of the skin or white part of their eyes or abdominal symptoms should obviously be in contact with their child's pediatrician.
ABC Chief Medical Correspondent Dr. Jennifer Ashton, thank you so much for getting us up to speed on all of this.
Thanks for having me.